Thank you to everyone who's tuning in for this. My name is Robert Mittendorff. I'm a venture capitalist out here in the Bay Area. I'm also a practicing emergency physician. I am with a firm called Norwest Venture Partners. We manage about $10 billion under management, and we invest across a variety of sectors: healthcare, enterprise software, consumer software, and companies, growth equity companies, and we have offices in Israel and India. We invest across the spectrum of companies from seed stage to buyout. So check sizes, from the below 1 million to above 100 million. And we consider ourselves invited guests in our companies. We really try to partner with them. My other job right now is as a practicing emergency physician. So I have been practicing part-time this month, which I've done for a number of years. And it's an interesting time. So hopefully that's a quick intro for you.
That's awesome. So my first question is a little bit about when was the last time you were in the ER?
Last weekend.
Wow. Can you just paint us a picture of what an emergency room in America looks like right now and where you were, which hospital?
Yeah, so I work at Kaiser out in the East Bay, and I have a number of colleagues that work at other facilities out here and in New York. And I think it's a pretty intense time right now in America's emergency departments. Different departments are experiencing different things right now, but it's intense. It's intense if you are already receiving a large number of patients that could have COVID-19, but it's also intense because we're all preparing for the eventual receipt of those patients. The good news is that emergency departments and hospitals are designed for this, and ER physicians and nurses in particular are trained to manage uncertainty, are trained to manage surge, and are trained to do what they can with limited resources. But it's a time where we're really testing that capability and resolve.
So in the ER right now, like what percentage of patients are coming in for COVID-19 and what are coming in for other reasons?
Yeah, so it's different by geography. In the Bay Area right now, the hospital I worked at 2 or 3 weekends ago, I think it was probably 25% of my patients had respiratory complaints.
Wow.
And some of them we consider called COVID rule-outs or patients under investigation. Because there are a number of other things that people are getting infected with, like flu and RSV still. And then I think the weekend before last, I think I was up to maybe 30 to 40% of the patients on that shift. Now, other parts of the Bay Area, like in the South Bay, have seen more patients in Santa Clara and San Jose, and they have more ICU patients. And then, of course, in the North Bay, there are some increasing number of patients as well.
Yeah. I want to touch on some of the biggest misconceptions you're kind of seeing about coronavirus that you want to maybe dispel, and some of the resources you're using to get your information from.
Yeah, I think there's a lot of information out there, which is good. I think one of the biggest, one of the misconceptions I do hear about is this idea that we're gonna reach a peak and then it's gonna kind of all go away. And
Uh-oh. I think we lost you there for a second.
Oh, it's better. 3 Zoom platforms here. So now we're on the cellular phone, but let's keep going.
Let's go. Okay. So you said we would be at the peak when? There was a misconception.
Yeah, I think in California, I think we've seen some great state leadership out here. And in California, the social distancing, which has been pretty extensive, I believe has slowed our ramp. And so one of my companies, we've spent a lot of time modeling this. One of my companies, Cuvenus, has spent time looking at this by specific geography. And we believe right now that rather than use the word peak, we believe we'll start to hit maximal capacity utilization without extensive increases by the end of this month. So if you take the existing hospital capacity in terms of beds and ICU beds and ventilators in California, and you overlay the prediction of cases and then the percent of those cases that need intensive care, you can start to forecast when you're assuming existing demand, when you will reach capacity to serve those patients in a normal way. And following that, reaching that capacity is what we call surge.
Okay.
So surge is when your demand exceeds capacity. That's probably in 3 weeks or so. Now, to be clear, when we forecast surge, what we also think about is how we augment capability and capacity. And so this valuable time we have right now is allowing health systems to expand their number of ICU beds, to get more ventilators and deploy them to hospitals in the state that need them, and to bring on more practitioners, et cetera, to be ready for that surge. So the surge will happen at a higher number and later date. That this time is very important.
So you're saying, okay, so at what point after the surge do you think things will kind of begin to even out, or is there that point?
Yeah, I'm hopeful that if we continue social distancing and our hospitals have adequate PPE ventilatory capabilities and staff, that we'll start to see some interesting things in May and maybe early June in the Bay Area. So I'm excited to see that, but there are a lot of variables that go into that equation. And I don't think we will see I think the challenges will be how we manage this over the next 8 weeks, 6 to 8 weeks, and what the backside of that curve looks like in the Bay Area.
Can you go into a little bit of where you get your information from? I know that you read certain blogs that maybe like the average person can access to for better information.
Yeah, so I read a lot of scientific publications and blogs that are mainly for clinicians. So one of my favorite is emcrit.org. It's a physician, emcrit.org. It's mostly for physicians. I track case counts at the Hopkins coronavirus, COVID-19 website, and on Worldometer, which I think most of us are aware of. And then I track local information at each of the counties in the area. So San Mateo County and Santa Clara County have information on their cases on their websites.
Got it. That's awesome. We have a question from someone who's saying, if you're in one of the vulnerable segments of the population, what lasting impact will this pandemic have on your ability to travel, attend events, and resume normal life? As an example, I'm a 69-year-old who planned a significant international travel in the next few years. I have a trip planned to Tanzania and Rwanda in September. Are those plans going to turn into a pipe dream?
Well, I mean, sometimes I take these questions as a physician and others as a son, and my mother happens to be kind of in that same age range. I would say for now, it's dependent on your local situation and the case counts there, combined with the fact that international travel right now is something that probably is not going to be a great idea in general. So I would, if I were advising my own mother, I would say for now, I would try to avoid, I would definitely practice aggressive social distancing and try to avoid situations where you might be endangering yourself with someone else's droplets. So that would certainly include flights, that would certainly include vacations. And I think we'll learn more and more about this in the next couple months. And those, things can change on a daily basis. But for now, I would kind of put those plans on hold.
Do you think, how likely is it that normal life resumes by September?
I think there are a number of things that would have to go right for that to happen. And I think this will probably be the new normal for a bit. Until we have a vaccine that's widespread in distribution. I think we will be adapting to COVID-19. So I wouldn't anticipate full normal in September.
We talked previously kind of about the phase 3 of this thing. What does the next phase look like, and what do you think we can do to kind of be better prepared as a country?
Yeah, so the next phase after quarantine, and remember, I think we are now up to 90% of the population is under some form of quarantine in the US. That was up from 80%, I think, last week. And we still have some holdouts. And so I think once we all agree that quarantine is the way to go here, I think the next question is, how do we reopen different parts of the country? Because the economic impact is obvious, and the duration of our policies here will affect the severity of the economic impact. So, how do we go about doing that? Well, I think Scott Gottlieb has commented on this quite a bit, and I would reference some of his work there. I think he published it at AEI. But I think very simply, we would have to have good data on testing, good data on case counts, and good data on severity at a minimum to understand whether the curves in various areas would allow us to consider relaxing quarantine standards so that people could kind of get back to work or other activities. I think that requires more data centralization than I feel like we have right now. And there are a number of individuals and groups that are working to improve the data assets we have to make these predictions more effective. I think we also are missing a bit on the ability to kind of create a federal or national stance on such policies right now, because it's largely being done state by state.
Is that a mistake?
I think coordination here among states is very important, because our state borders are porous, even without airlines traveling between them extensively. Our state borders are porous. And so obviously, this is a virus that can infect individuals and remain asymptomatic in many, which allows the spread of it, even if you control a local area. And so I think a national approach would be more effective and would be shorter in duration. And I think you've heard from people far smarter than me on that, like Dr. Fauci, who I respect on this and believes that a more coordinated national approach is probably better and probably could achieve results in a shorter period of time.
Yeah, and let's talk about data a little bit. As a doctor, how much data is available to you on a day-to-day basis for you to do your job, if any? And what do you think about this testing backlog that we're experiencing right now?
Yeah, well, so the physicians treating, and remember, I'm part-time. There are a lot of people on the front lines working daily on this. The physicians and nurses treating patients in New York and in Washington State and elsewhere, where they've seen a more rapid rise in cases, are sharing their lessons with all of us. Some of that's formally through publications online. There was a great one that came out on the Elmhurst, kind of the first phase of their management protocols in the last couple of days, and some are in more informal channels. But that information is kind of multimodal, and it's something that we're all trying to get our arms around. In terms of the testing backlog, I think that we were, as a country, not ready for this pandemic. If you think about national readiness, it's pretty clear we weren't ready. We're catching up, and private industry and coordination at the state level and ingenuity has really driven a lot of great change here. But I think it's the testing backlog I certainly haven't seen in my career as a physician over the last couple of decades before. And although we're catching up, we're still behind.
Yeah. Samantha asks, hopefully this is a once in a lifetime event, but curious to know what you think the most important lessons from the coronavirus response have been, and some of the changes that need to happen to better prepare for a future epidemic.
Yeah, I think, Americans are optimists. I tend to be one. Most of us are.
You have an American flag behind you.
That's right. Planning for the Black Swan event is not something that many of us like to do. But readiness is incredibly important. And I think here what we'll learn, and we're certainly not through it, so I don't think we have the benefit, the hindsight of collecting all of our lessons. But what we'll need to come out of this with is a healthier understanding of what readiness means in the case of pandemics. And I hope that we come out of it with an understanding of the heroic aspects of physicians and nurses, and of our health systems and what they provide our communities and our country. But we will need a better plan, a bigger plan in making sure we have access to proper testing in a rapid manner, centralized data assets and feeds to understand where cases exist and the severity of that set of cases, sharing of best practices for whatever comes up in a centralized way, deployment of rare assets, in this case ventilators and PPE, in a very programmatic way. And then, of course, this is all on the medical side. And then, of course, rapid understanding of what treatments or preventative measures and dissemination of those can be found and executed on. So I think we'll learn a lot of lessons. I think this will ultimately end up in a bigger plan or program for pandemic preparedness and readiness, which will include, a large part, in large part, the private sector.
Yeah, you mentioned last time we talked that you kind of see the government as a policy setter and a policy maker, and you see the private markets kind of executing. Can you explain, elaborate a little bit more on the relationship between public and private markets and how they can come together on something like this?
Yeah, I think it's been, although we came a little late to the party, I think the private and public sector right now are interfacing in a positive way in addressing the pandemic. So private sector works well. As a venture capitalist, I fund companies and watch companies innovate rapidly, and they work well to find innovative solutions and get to those solutions fast and at scale. Government can assist in coordination, in policy setting, and in driving specific targeted resources. So a specific example that I was happy to see employed is the Defense Production Act. I think in this kind of situation, that act provides the federal government the capability to nudge and even coerce private industry to produce solutions necessary for our country. And I think examples like 3M and others show that there will be real value accrued to our frontline workers, healthcare workers, with employment of that kind of government policy. Private industry has done a great job in the development of diagnostic capabilities and even in therapies right now, with Gilead leading trials on remdesivir, and other companies looking at the capabilities of their medicines and therapies for the treatment of this pandemic.
Yeah, and you're actually an investor in Talkspace, which is a therapy app, telemedicine therapy app. One, have they seen an increase in usage during this pandemic with people seeking help? And two, what do you think are the consequences for people's mental health after something like this?
I think that's a great, so we are investors in Talkspace and proud investors of that company, I think, COVID-19 presents a multitude of challenges for our society. First of all, a healthcare problem. Second of all, economic problems. And I think third, we'll see as part of healthcare are behavioral health issues, which may last longer than the other two. So we've seen a lot more interest at Talkspace. We've seen more signups. We've seen more people engaging on the platform. It's very accessible to anyone. It's an online text, video, and audio-based therapy platform where you're matched with an actual therapist, and people are getting a lot of value out of it. I think these solutions are helpful in this time where people can't go see a therapist, people can't access them, and they can't do it in a way that's cost effective for them in many cases. So I think after the healthcare and economic effects of COVID-19, and even during them, we will be dealing with and managing the behavioral health aspects in our society. It's something that we can't ignore.
Yeah, and right now the US is kind of fighting a war on two fronts, right? There's the global health epidemic, and then there's the attempt to prevent a collapse of the economy. How is it possible to do both? And if so, how?
Well, I think COVID-19, it does create challenges in both areas, and the challenges and solutions are inextricably tied to each other. So if you don't manage and solve the healthcare challenges with COVID-19, you will not be able to solve the economic challenges. They're inextricably tied. So every policy decision and every strategy around this disease, around this infection, links the two. For example, faster, more aggressive quarantining, which leads to a lower number of cases, and it leads to fewer likely fatalities, can allow you to control the viral effects on a population, and that will have a direct translation into economic activity. The bottom line is that COVID-19, in a sense, in our democratic capitalist society, is focused at our Achilles heel, which is human interaction. You know, as capitalists, as people in a republic, in a democracy, we like interacting. Our society is built on interaction, whether it's for political, economic, or social or cultural means. And I would argue even more so than in other areas of the world that might function in other political ways. So this virus strikes at the core of that, around freedom, around the ability to move freely. And so when we talk about quarantining parts of our society, we have a direct impact on our economic, social, and cultural exchange. And so these are really important things to get right. And as you said, in this next phase about how we start opening up our society again, making the correct choices there are really important.
But this is my biggest question is, at what point, and I don't know who actually is going to make this exact decision, but how policymakers and the government decide, okay, now is the time to open society back up? Isn't there a risk that the same thing will happen again? We can't see the virus, we can't avoid the virus. Like, when is the right time?
It's a very complicated question, and it's going to require a lot of data and a lot of expertise to figure that answer out. There's not a simple answer to that. I think to your question is, there's going to be choices that are made to try out policies, is what I would imagine, because we don't exactly know what the effect of opening up. And by the way, we're not even through this yet. So I think we're thinking probably months ahead here. But I think when we get to a point where we have some understanding of where a curve has peaked, say, for example, in New York, these are the kinds of questions that policymakers will need to think, that they will be thinking about. And it should require, or hopefully we will see, a close partnership between government officials, the public health authorities and health systems, and the economic interests, because they are all directly tied to each other here.
Yeah. Okay. Some good questions. Bill asks, how can a product that can help people with COVID that has received EUA, emergency use authorization, quickly get adopted across fragmented healthcare system?
That's a great question. So as a healthcare investor, getting rapid adoption of any technology across our healthcare system is a very nuanced and complex process. Realize right now, most health systems are looking at their operations and are heavily influenced by the effect of COVID-19 on their operations. So most of them are not doing elective surgeries. So the answer to that question is, it's not simple. It depends on what you actually have. So if your device is something that could help double, treble, or quadruple ventilatory support capabilities, that might have more rapid adoption. If your technology has maybe a tertiary use, it might take longer to get the attention of leadership right now, because all hands are on deck in the management of this pandemic.
Yeah. Another question from Andy. Many of the barriers to telemedicine, like cross-state physician licensing, reduced reimbursement from insurers, et cetera, have been waived in emergency measures due to COVID. Do you think this is the new normal, or will these be walked back eventually?
I think COVID-19 will be looked back at as the single most important driver of telemedicine, probably in my practice lifetime. Mm-hmm. We were seeing a step change in the use of telemedicine. I think that the leadership by Secretary Azar and the HHS and CMS in developing ways to pay for these services is critical in their use right now. And I feel like we will reach a new normal in the use of telemedicine. I don't feel like we'll go back to where we were. And I think telemedicine will become an efficient, effective, safe way for a large percentage of appointments with physicians to be conducted. For example, follow-up appointments for surgery. How many of those need to be done in person? Some will, but maybe not every appointment. Management of chronic disease, where drug dosing may change and you may not need laboratory results or physical exam findings. I think we'll see a large percentage of medicine move into the telemedicine domain. It still will be a minority of the appointments that physicians will have, but we'll see a large percentage move to that space, which is lower cost and usually which patients prefer.
Really? So patients do prefer speaking with a doctor virtually, and they don't want that physical interaction in your experience?
I wouldn't say that in general. I would say it depends on why they're going to see the doctor, and it depends on the person. But if you look at data from a large number of sources on this topic, convenience for a variety of appointments, convenience and cost are very important to a large percentage of the population. And being in front of a doctor or paying a higher price, or the inconvenience of driving and parking, et cetera, for many appointments is not something they're excited about. But again, it comes down to the type of appointment. If you have a recurrent issue that you need to see your doctor about, or you need a medicine refill, or you need management of a chronic disease that doesn't require them to examine you in great detail, then many of those patients would elect to have, in my opinion, a telemedicine visit.
Totally. I'm definitely one of those people. Greg asks, right now you're probably doing your board meetings virtually. Once we're back to normal, do you believe that virtual board meetings will expand the reach of investment capital beyond the current geographic limitations, or will board meetings return back to face-to-face?
So I think the question there is around virtual board meetings. Does that translate into broader geographic interest in investment opportunities?
Let's say yes.
Yeah. So I would say there's a reason that venture capital is centralized around specific innovation hubs. Innovation exists, the stuff that we invest in exists within an ecosystem. And it's not, I've worked with a number of academic powers in this country and even overseas. It's not easy to build an ecosystem for innovation. So I would say, and the reason for that is you need a combination of innovation and technology with management experience to develop, build, and grow high growth enterprises, with experience on how to exit those companies to strategics or the public markets. And that is hard to do without being close to those entities and spending time with them. It's a great question because virtualization is going to affect every part of our society and doing activities virtually is affecting board meetings, will affect diligence of new investments, and will affect the supervision and coaching of those investments and helping them. Whether it translates into changing where we invest, I think is an open question. Maybe, but there's still a lot of value in being in an ecosystem, even if you're not meeting face-to-face, where individuals have known each other and worked together before because they're from Silicon Valley or New York or Boston or the Research Triangle. And so even though they may not be working in a physical location together, they've worked together before in that ecosystem.
Mm-hmm. Yeah. So we've all, read the news about all these startups laying off employees and kind of figuring out what to do with all their cash right now. What do you think, what have you advised your portfolio companies to do in this new environment?
Yeah, so and can you still see me okay? Yeah, so we wrote about this a little over a month ago. We've worked with every single one of our portfolio companies over the last month on 3 big areas. First is think about the safety of your employees. And that just doesn't mean their physical and healthcare safety, but medical safety, but also their safety of their behavioral health. 2 is think about the safety and accessibility to your clients and to your suppliers. And 3, develop a COVID-19 operating plan. And what that means, that third leg of the stool, is to think through every aspect of your business, from revenue, from the P&L, from revenue to cost of goods, to your operating expenses, to your supply chain, to your capitalization, and try to figure out a plan to get to 2 years. That is the end of 2021.
Wow.
The theory there being the vaccines that are being developed are going to take some time. Hopefully they'll be available by then, but it's going to take us some time to fully work through this process. And that goes back again to this idea of being ready. Let's hope it doesn't take that long, but we need to be ready for that. It's kind of like jumping into your car and driving around. You wouldn't think twice about not wearing your seatbelt. You would wear your seatbelt. You're not planning on getting into an accident. You're planning on driving to the store and wearing your mask to go get some food. But the reality is accidents happen and you need to be prepared for them. So this is a form of insurance. Think through these plans. And I think underlining all 3 of those areas of safety of employees, safety of your clients and your supply chain, and then of course your COVID operating plan, is this opportunity to adapt. Think through how your organization is going to adapt to the current environment. That will require some to reduce the force of employees. That will require reductions in salary sometimes. That will require, increasing the deadlines that they may have to get through this period where they may not be able to sell any product for a period of time. And all of those things will be important to think about. And then I think you approach all of that with kindness and thoughtfulness and an open heart.
Yeah. And we have a follow-up question on that around your investment thesis. What process do you use to identify companies or sectors to invest in within the medical space? And once you have identified those, what process do you go through in evaluating the company as a potential investment?
Right. So there are 3 ways we get deals. I'll talk mostly about one type in healthcare. First is we look at firms that we respect have invested in. Second is we look at business plans that come from people that we respect or that get to us in some other vein. So that's inbound or syndicated deals. The third, which is the more valuable of the 3 areas, is what I call thesis-driven investing. And at least half of my investments are thesis-driven investments. Identify a market or an opportunity that we want to find a company in because we think there are macro effects or effects around technology utilization that make sense. And then we try to look and identify every single company in that space and we try to meet with them all. Mm-hmm. So in the case of one of my companies, Tiger Connect, which is a unified clinical communications platform for health systems, that is how we found them. And we tracked them for 1.5 years before investing. Qvenus was another company we found that way. And then one of my latest investments, Impel Neuropharma, was the same thing. We had a very specific thesis and we looked at every company we could find in that space, met the management teams, consumed their stories, and really thought about who are going to be the winners here.
But do you approach it sort of differently given that you have worked as a doctor and maybe not necessarily as a long-time investor?
Well, I think, I've been an investor now for 8 years, finished residency in 2008. So I have that kind of overlap. I also was involved, I was a public officer of a medical robotics company with Fred Moll that he ended up buying back before selling Auris to J&J for $3.5 billion plus earnouts.
It was a big acquisition.
Yeah, he's an amazing leader. I would say, so the combination of the operating experience I've had in a publicly traded company as an officer of that company, and then as a physician and as an investor is very helpful in looking at new deals. I think in terms of how it helps me, I think of investing as frankly finding the right theme and company and entrepreneur, getting the right deal done, getting the right price. That is earning your way onto the board. So every company I target, I ask myself, why would this entrepreneur want to choose me to be on their board? How can I help them if they so call? And again, we're invited guests. We ask if you need help, we're there. And then the third is, once you're on the board, is adding value. So that selection process on the front end to really convincing these great entrepreneurs that you can add value, to then actually adding that value, is really has been helped by my experiences both in three areas: as an operator, as a physician, and over the last 8 years as a VC.
Yeah, we spoke briefly about the future of venture, the future of small businesses, in the future, if we do go into this deep recession or depression or whatever it may be. You said that you're more concerned about the kind of non-essential service business right now. Non-essential being defined as you're not working on the front lines, at the moment, right? Yeah.
Right. Meaning, yeah. So this term of non-essential worker right now, which is a little bit of a charged term, but in terms of where we are in the quarantine, has put a lot of people at low to no work. The restaurant industry has been very seriously harmed. Nail salons, people that cut hair for a living, people that clean houses for a living are hurting right now. Small businesses that do this are hurting. They don't have 5 months of cash on their balance sheet. There are programs that have been recently produced with the $2 trillion in commitments for businesses like this, and they should take advantage of them to try to stay on their feet. But I do think those workers, just like our companies, should be thinking about how to adapt to this environment for some time. And I think that's where I think it's probably the wrong advice to assume that there's a month or two of this quarantine and then we're back to normal. I think that's not the right advice, because it doesn't help people plan for and be ready for the potential that it could go on longer.
Mm-hmm.
And I think going on longer means people should think about how they can adapt. And that could mean acquisition of new skills online through training programs or degrees and such for new industry opportunities. That could mean finding a role with a company that is growing right now, that is in this essential services area, and many of those companies are hiring. And that could be working for companies that are looking for non-full-time workers to work on many of the projects as they continue to try to move forward in this economy.
Yeah. Also, an interesting question here from Samantha. Do you think businesses have a moral obligation to help right now?
I do. I think that this is a time for in any entrepreneurial setting. I can tell you it's amazing to be around entrepreneurial companies and leaders, because they're very mission driven. And I think all of them are thinking about right now how they can help in whatever way that their company is capable of helping this broader effort. And that's a really marvelous thing to watch. And it's a celebration of American capitalism, to be honest with you. And so I see a lot of our companies stepping up. That's on how they can use their resources to help out this great challenge we all are dealing with. But I also think those leaders are looking at how they can be direct and straight with their employees and their stakeholders, but also survive. I think one of the most amazing, and I think it will be studied at business schools years from now, is the CEO of Marriott's video message to his employees, which I would encourage anyone to watch. It is in a time when Marriott's really being heavily hit with this. He's very direct and frank with his employees, but he's also kind and caring and compassionate within the confines of what's capable in that company. And I don't study Marriott closely, but I can tell you that that's a portrait of leadership that I respect, and that I hope many other CEOs and leaders model in this hard time.
From the companies in your portfolio, how many of them have already undergone layoffs already today?
I probably wouldn't want to, I'll give you general numbers because I think we're still moving through this process. I would say that every one of our companies is they have or already are building a COVID-19 plan.
Okay.
And many, if not most of those plans involve salary cuts for everyone to preserve more workers, or removal of some positions and salary cuts or removal of positions. I don't think there's a single company that's not looking at how they can shave cost right now.
Mm-hmm.
But I will tell you that shaving costs comes in different buckets. So sometimes it's elimination of unnecessary marketing spend instead of headcount. And so that's where the bespoke process by company becomes incredibly important. But every single one of them is looking at what they need to do to survive as organizations during this very challenging medical and economic time.
Yeah, one more question about any thoughts on non-essential medical practices such as dentists, optometrists, and others that don't have the cash to sustain their practice. Will we see a period of increased consolidation or private equity roll-ups?
Yeah, so we are, and you can still hear me. Am I still in good bandwidth? Yeah, so we are investors in services companies as well. One of my other partners leads those investments. And there are two sides to that coin. Number one, elective procedure bans or reductions directly affect our ability to grow those businesses or even sustain them for a period of time. On the other side, we know those businesses are going to rebound, and we know there are opportunities out there to invest in other businesses in the services space. So in some sense, we have to think about how we preserve those organizations and those investment theses. On the other side, we are, as investors, looking at how we can think about investing in areas that might not be doing well right now, but we know will rebound. I mean, the reality is, although this may change how dentistry is practiced, although this may change how other areas of medicine are practiced, it's not going to obviate the need for dentists. We all will have, we will have to go back to the dentist, and we will have to re-engage. It might be in a different context. I think it's useful to study prior situations, like in the 1980s when HIV came on the scene, and the transformation that HIV had on how medical care was delivered with respect to precautions that physicians take with patients when they're dealing with that disease.
Very interesting. Guys, we're kind of approaching the end, so if you have any more questions, feel free to ask it in the Q&A chat. And my question is, right now, I think that a lot of people are sitting at home, which is the best thing they can do. But there's a lot of feelings of powerlessness and isolation and loneliness. Are you seeing any of that? And what can people do right now?
Yeah, I think I am seeing that. I think we're seeing it in our companies. We're seeing it even in our own firm. You're seeing it in society at large, and then certainly with friends and family. This is a challenging time, especially for people that are used to being social and in person and going to activities. It's a challenging time. We have to acknowledge that. I think it's a time to practice patience and kindness and compassion. I think, which is not easy to do in every situation. I have a 7-year-old daughter, and practicing patience as I'm trying to occasionally homeschool her while also doing Zoom meetings myself can take some practice. But we're all learning kind of a new normal. I think that there are services out there. So Talkspace and its other contemporary services are one way of engaging virtually with people that can help. I think spending time virtually with friends is super important. And I think just resetting the expectations right now as we enter this time of transition, and giving people time to start managing their life in a different way by still being productive is important. I think we're going to learn a lot of lessons out of this. I think we're going to learn how much virtualization can happen. I think we're going to see probably a change. I mean, if anyone had this idea of, if you were purely a social media society with no human contact, what would it look like? Well, here we are. And I think we'll see more people after this focus on purposeful socialization in person, take advantage of being in person with people as a kind of a different way of engaging, which I think is good. And I think, we might see some things on the environmental end. This is a great, example of what happens with respect to, carbon and other things as we reduce our utilization of certain, assets and resources in society. And so I think there are going to be a number of education is going to change, a number of interesting lessons that will come out of this. But in terms of, dealing with the day-to-day right now, there's a lot of anxiety and fear and depression out there. And there are services for those individuals. I worry quite a bit about those workers that are not going back to work right now. And I worry a lot about the people on the front line. I practice part-time. Those full-time workers, those healthcare providers are going to, they need resources, they need support. And I think it's really important that we do that for them.
Yeah, and on the flip side of that, somebody asked, what have you been doing to decompress and stay happy during these times?
Well, that same 7-year-old's a big amount of happiness for me. So I can kind of get used to working from home with her there because I get to have lunch with her occasionally in between her classes and such. I think, I've taken advantage of, working out is very important. I think it's important that people get outside and not congregate and not show up with a 10-person Frisbee match, but going for a run through the neighborhood and staying 6 feet away from other people, I think that should be something people should be doing, going for walks with the people in their immediate family that they're exposing inside their own home unit, I think is important. Getting outside if you're in one of those parts of the country where that's possible and still abiding by those quarantine recommendations. I think it's really important. So exercise is important, standard stuff, exercise, sleep, spending time with the people that you care and love, and family members, obviously, whether that's virtually or in person, if they're actually in your house unit. And then, just being more patient with yourself.
Yeah, awesome. And to close this out, can you kind of give us your informed prediction of what the world looks like in 6 months? Are we all just going to be like so deprived of social connection that we're just going to run to the clubs and go to concerts and party our faces off? Or is it going to take a while for people to start coming out of their homes?
I think that'll be dependent upon the groups we're talking about, and I think it's hard to predict. I think that this is where the importance of state and federal policy is important. People do trust what their leaders tell them, and so if their leaders act a certain way, or they say it's okay to now start doing this, mm-hmm. I think that's when society will start to trust that and may go back to normal. However, I think we're far from that right now. And to your question around the fall, I think the fall will be dependent upon the next 2 months and the summer. And so it's not time to really, there are too many outcomes we could try to predict, when too many variables that we don't have access to right now to really say that. Will society return to, some semblance of where we were before? Absolutely. We will have a vaccine. The vaccine will be distributed at some point. And that, even if we do have to manage this in the interim, will be a key part to this war. In the interim, I think there will be changes. I'm not sure when, New York's clubs will come online the way they used to be before, or when, Lollapalooza will come back to the way it was. But I do think it's just harder when everyone's 6 feet from each other. But I do think that we will see creative ways of bringing back our culture in the interim. And, if there's one thing that's been amazing to watch in this time of challenge and tragedy, is the really creative, teamwork-based approach and optimism that you see in the United States. It's just amazing to watch. I have the privilege of watching small companies do this, and they try to do it every day, whether it's in New York or Boston or DC or the Bay Area or LA. But I think the broader society is seeing really this, amazing American spirit, this optimism and this problem solving and this reaching out and saying, how can I help? Which I think is really an amazing thing to watch. And I hope that continues as we manage this over the next 1 to 2 years.
Yeah, just trying to stay optimistic and all turns out well. Thank you guys for joining. Thank you, Robert, for doing this. I really appreciate it, and I thought that was really interesting. This will be recorded, and maybe we'll share it later with everyone.
Thanks for inviting.
Thanks so much. Have a great day.